I think we're ready to go, Hayden.
Okay, great. Well, thanks very much. And as you can all see, the title of today's webinar is Vaping Cessation. And I'm going to take you through where we are with the evidence base at the moment, which I'll start off by saying is not particularly strong in this area. So I'm going to present what we do know, some guidelines in this space that have been developed, but just want to say this is not a clear-cut area like using nicotine replacement therapy for smoking cessation. Okay, so first off, why help people quit vaping? Well, we all know we've seen an increase in vaping prevalence. So with that, an increased number of people vaping, it's likely that we'll see an increased number of people who vape who want to quit vaping. Now, most of these people are probably going to be those ex-smokers that have transitioned to vaping, and some of you might have actually helped these people stop smoking using vaping, and they will want to quit vaping at some point. This is not dissimilar to people that want support in helping stop use of nicotine replacement therapy long-term. However, what might be a little bit different in this space is that we may see some people who have never smoked but have taken up vaping and have become dependent on vaping and want help in stopping vaping. So that's a little bit different than we're used to. Most of the clients that we see are smokers, of course, but now we might see some never smokers that have become dependent on vaping and want support in quitting. We saw that, if you haven't seen it already, in the ASH Year 10 results from this year that showed about just over 3% of never smokers, young never smokers, report vaping on a regular basis. Now, it's not to say that everyone who vapes is going to want help in quitting. That's not going to be the case. And many will manage to quit vaping on their own, just like many smokers manage to stop using NRT on their own. And some, though, will benefit from support. So some might struggle a bit or not quite sure how to go about it. And so some support from services or resources might be helpful. And I think it's important just to acknowledge that whilst we agree vaping is less harmful than smoking tobacco, it's unlikely to be completely harmless, especially over many years of use. And I think this will be one of the key drivers for people wanting to quit vaping, will be concerns over health. So, well, how many vapers will want to quit? Are you going to expect to see a huge influx of people through your doors? I don't think that will be the case, but the number of people that want to quit vaping are going to depend on a number of factors, very similar to smoking-related factors. So the environment depends on how difficult it may be to access vaping or not difficult to access in vaping products, what the health risk is and how that might change over time. In the US, we saw an increased number of people wanting to quit vaping after they had the EVALI episodes. That's the e-cigarette-related severe lung injury that they had associated with vaping some adulterated cannabis products. And also cost. So as cost goes up, then it's likely that more people will want to quit vaping. Now, we don't have good data from New Zealand to really understand what our situation is here, but international data suggests that about 1 in 7 vapers, exclusive vapers, so they're not smoking as well, had tried to quit, and about 1 in 4 showed willingness to quit in the future. So they were planning to quit at some time in the future. So there you go. That gives you an indication from overseas markets. Among young people who are exclusive vapers, this might be a little bit higher. So some data suggesting around 58% were intending to quit vaping, and 70% had tried at some time in the past year as well. Now, that might reflect a population who were never smokers as well. So vaping, this context is a little bit different than someone that might be using vaping as a smoking cessation aid.
Hayden?
Sorry, yep.
Can you just recap what are if any, the health risks of young people vaping nicotine?
Well, it's perhaps not so much the nicotine, apart from the fact that these young people are becoming dependent on nicotine, which has its own implications in terms of cost and loss of control over behaviour. But we do know that some of the constituents of vaping products are, do have adverse consequences on respiratory cells. So we know that they can irritate or be associated with chronic inflammation of respiratory cells. And whilst that's much, much less than smoking, if you're coming from a point of never smoking and you take up vaping, then that's a potential increased health risk, especially over a longer period of time. And the last point on here is just to show that plans to quit vaping differs by country. So if you look at the data from England in the International Tobacco Control Project, it's around 15% of exclusive vapers plan to quit versus 43, 44% in the US and Canada. So quite different approaches to how they see vaping, I think, is really one of the main drivers of that difference. In terms of reasons for quitting vaping, health concerns is probably the most frequently reported. And a lot of data has come from surveys of younger people vaping. But cost and social unacceptability are also reasons that are bubbling up and reported in the literature. In terms of health harm, and as we go through, I think we'll see more data here. I can't predict what it will be, but certainly perceived health harm is associated with intention to quit. So if you perceive that vaping is dangerous in any way, then that makes you more likely to want to quit. Now, that's nothing surprising. I think everyone knows that. We've seen that with smoking. Some commentators, such as this paper by Dye, have suggested actually vaping cessation programs should emphasize the adverse health outcomes associated with vaping. I think I'd take care with that approach because we don't want those messages to get back to vapers who have used it for stopping smoking and they relapse to smoking. And we don't fully understand the health harms associated with vaping either. So I'd be cautious about racing in and saying, oh yes, vaping's terrible for your health and it causes heart disease and it causes lung cancer when we don't actually know that yet. So you've got to be careful to stick with the truth and the evidence. But I also think that our experience in smoking cessation is we don't always go ahead and emphasize the dangers of smoking, but more about the benefits of abstaining or quitting. Now, what are some of the barriers to quitting vaping? Well, there are several reports now that describe withdrawal symptoms among people quitting vaping. So this shouldn't surprise you. If you're addicted to nicotine, then you might expect some nicotine withdrawal symptoms to appear. There are a paucity of data, though, overall to really describe the withdrawal symptoms among vapers, and especially the severity compared to tobacco withdrawal symptoms associated with quitting smoking. But just to give you an example, this is some qualitative data from adolescent vapers, and they found that negative emotion was probably the most commonly reported withdrawal symptom, but others included poor concentration, increased craving to vape. These are things we see with smokers when they're quitting, but also headache was reported here. Headache's not a true tobacco withdrawal symptom. I doubt that's the case with nicotine withdrawal here as well. But anyway, that's what was reported in this small qualitative study. Other barriers to quitting, well, big influences like having friends that smoke, whānau that smoke, easy access to vaping, they're all barriers to quitting vaping as well. So I hope you can sort of start to get to see some of the similarities here where you might approach supporting people to quit vaping are quite similar to quitting smoking. Maybe avoid your vaping friends for a while if you're trying to quit vaping. So how do we go about all of this? Well, there are a few things, as I mentioned, that are starting to appear in the literature. The approach with the strongest evidence to date, and I mean by probably the most robust clinical trial that's been published so far, is a single trial of a text message program for vaping cessation in young adults. And they found that at 7 months after they were randomized to either the text message program for vaping cessation versus a sort of non-specific text message control, those were the quit rates at around that 6-month mark. So 24% versus 16%. Not a big deal, right? And I think, just probably started to think, well, that's not dissimilar to smoking cessation rates. So none of these things are magic cures. So behavioral support, I think, is probably where the greatest amount of evidence lies at the moment, but other approaches are being examined. Now, these include reducing the frequency of vaping, so trying to just reduce the times that you vape over the day. Others have looked at reducing the nicotine concentration over time. As I think I've mentioned before in vaping-related webinars, I think there needs to be some caution about the approach to this here, because people do tend to compensate for lower nicotine concentrations by vaping more often. Some researchers have combined both the reducing frequency with the reducing nicotine concentration over time, but these are very small studies, and it's difficult to make some definite recommendations from those. Other studies have started to look at pharmacological agents, so nicotine replacement therapy, varenicline, some small pilot study work, and there's a study, I don't know that it's started yet, but a randomized control trial looking at cytosine for vaping cessation. And then others have sort of started piloting incentives for vaping cessation, financial incentives, contingency management sort of things, which may be important. So lots of people looking at lots of things, but really small studies at the moment. And with the exception of the text message program that I've mentioned already, I don't think strong enough to make any definitive guidance for the whole sector on, especially in terms of some of the pharmacological approaches. I just want to just touch on vaping cessation in this particular group of young people, because that's where there's been a few surveys in this space. And obviously this is where the emphasis has been, especially among young people who have never smoked that are taking up vaping. So a couple of surveys first off. One that found that young people who vape mostly prefer to quit cold turkey. They just stop. And interestingly, you've got some young vapers that are stopping for sort of a tolerance break. So they stop for a month or so, so their sort of tolerance levels drop again. So when they start vaping, they get more of a high. I found that quite interesting that people are doing that. But anyway, that's a bit of an aside. So apart from cold turkey, others are adopting general behavioral approaches like avoiding social cues, cutting down, and distractions. So playing video games, listening to music were used as approaches for quitting vaping among young people. Another study published last year, again among young vapers, they asked them, what would you be willing to use? Actually, again, overall, didn't want to use anything. But when pushed, which would they be most willing to use? They mentioned apps, web-based material, and medication was quite low on the list. So don't expect, I think, here a whole lot of young people rushing up to want to engage and stop in face-to-face services. It seems they'd rather do this rather anonymously through digital media. Others have gone and focused a little bit more on this young person cohort and tried to explore what would they really like. And here they've suggested actually people who vape, young people who vape, did want some personalized health feedback. You know, why should they be worried about vaping? And that's really in that if you want, in that contemplation, pre-contemplation stage where, why is it that I shouldn't be vaping, or why should I be worried about vaping? When asked about what sort of programs that might be, well, some rewards would be nice. So there's your incentives to quit. And what might make up a support program, they're talking about goals to reduce use, frequency of use, for example, participating with a friend, so social support. And again, this group didn't want to use medication. So I don't think at the moment this would be my first approach to offer everyone NRT. I'd especially focus on some of the behavioural approaches to vaping cessation is where I would personally start. In terms of formats, they didn't really mind. They suggested a range of different formats, but delivered during school time, and not delivered by parents or teachers, but either by peer counsellors or someone from outside the school. So if that confused you all, and you still don't know what to do, you're in luck. Recently, the Canadian Centre for Addictions and Mental Health have developed a vaping cessation guidance resource. Now, this is just guidance, and this was developed by a Delphi panel. So it had a range of experts from around the world that contributed to this development. And we were asked to think about statements and whether we agreed and by how much, to try and get some consensus on what we might do now in the absence of stronger evidence. Okay, and I've got the link down the bottom there, but you can have a look at this online, but I'll show you what some of their recommendations are. So first off, they suggested actually we should be just asking people about vaping. And that's something we really do need to start putting into our health systems, just as we do with smoking, checking on use of vaping products. For those that were former smokers, we sort of all agreed that actually if they're advised to quit vaping eventually, that they really need to be monitored for relapse to smoking. That we don't want ex-smokers who are using vaping as a cessation aid to go back to smoking. So it's a careful balance here. They also suggested some vaping assessment tools. There are some tools for assessing vaping dependence. I'll touch on a couple of those at the end. But you can see those recommendations in 1E. In terms of language around nicotine use disorder or dependence, there was no consensus here. And I don't think we need to get into that too much. Oh, here we go. Here are some tools for assessing dependence on vaping. So there's the EFTND, so that's, you'll all be familiar with the Fagerstrom test for nicotine dependence. Well, there's one for e-cigarettes. And you can see there's scoring at the bottom, but if you add all these up and you've got 8 or more, then you've shown to have some high degree dependence on vaping. Another one a little bit longer, but the Penn State Electronic Cigarette Dependence Index. So these are just a couple that you can use if you want to use when dealing with vapers to assess their dependence. Okay, so again, back to the vaping cessation guidelines. This is the next section, and 2A is about those who quit smoking and continue to vape should be advised to quit vaping. So this would be in your regular healthcare settings where you've got people that have quit vaping, quit smoking, but are long-term vapers that ideally you'd advise them to quit. For those who vape but have never smoked, they should be advised to quit vaping as well. Currently no agreement on a recommendation for the general approach for the treatment of people who are both smoking and vaping, these dual users. But I think we can approach this in a number of different ways. My approach is usually to make sure they stop smoking and get on to the less harmful approach, and then hopefully get them off vaping as well. Now, treatment approaches. So this is recommendation 3, that the treatment duration is minimum of 8 to 12 weeks. So this is very much based on what we know from smoking. So this is translating the evidence from smoking cessation across to vaping cessation. Also identified that those with mental health and substance abuse issues who vape exclusively can be offered a combination of behavioural therapy strategies with or without pharmacotherapy to help them to quit. Those are pregnant or breastfeeding who vape. The decision here was to offer behavioural therapies as a first-line treatment. NRT may be considered as second line for this group. So it wouldn't be something that you jump in there first. For dual users, people who are both smoking and using e-cigarettes at the same time, the advice, as I said earlier, is to encourage people to completely switch from smoking to vaping only. And then later on, when you feel that they're safe, that they won't relapse to smoking, that you could encourage them to quit smoking. Now, pharmacotherapy strategies, just to point out here, there is currently no evidence for pharmacotherapy recommendation in helping people. Sorry, that should be, I'll reword that. There's no evidence for the pharmacotherapies that are used in helping people stop smoking, for helping people stop vaping. So the use of these medications is off-label. And we've got this added issue in New Zealand where subsidized nicotine replacement therapy is for smoking cessation. So if you were going to use it for vaping cessation, it's off-label. And I'll come on to that in a minute.
Will you explain what off-label means?
Off-label means you're using it against the indications or outside of the indications, off the labeling.
Of that medicine.
Of that medicine, yeah. So if the medicine says this medicine is indicated for smoking cessation, and you're using it for vaping cessation, i.e. vaping cessation is not included on the label, then you're using it off-label.
And is that okay to do that, or is that forbidden?
It's okay, and prescribers do this quite occasionally, and we did this with nicotine replacement therapy for some time. If you remember back when NRT was not indicated for pregnant women who smoke, if you used NRT in that space, then you were using it off-label. And some of us did, because we discussed it with our clients and we agreed that this was the best approach to take.
Great, thanks.
Okay. But here are some guidelines that give you some sort of help here, I suppose. So it's saying adults, youth, and people with mental illness or substance use disorders who want to quit vaping and are willing to use pharmacotherapy, it can be offered. And it's saying you could use or offer any of these particular things if available. Now, you have to be a little bit careful. Again, in the New Zealand context, if we had varenicline available, it's not at the moment, but that's on special authority indicated for smoking cessation alone. So I don't think that you'd be able to use varenicline in New Zealand, at least the subsidized version for vaping cessation.
So you're not telling us here that this is a guide to how we should help people stop vaping. You're just explaining some of the evidence that's coming in from overseas.
Yeah, absolutely. And you'll get some doctors that are completely happy to work in this space and use off-label. But I'll come on to what I think the approach should be here in a minute. The panels couldn't agree on the recommendation for medicines for women who are pregnant or breastfeeding and want help. So they suggested, well, over to providers to sort that out for themselves and make an informed decision. So here's where I think it all sits at the moment in terms of medications. So varenicline, if it was available here, my feeling on this is probably no, because it's subject to special authority and only as a smoking cessation aid. So unless that special authority's changed, then probably not. Bupropion, maybe, but you're going to need to get prescriber support for that. Again, that would be off-label. I would consider it in someone that was vaping if nothing else had changed. Cytosine, similarly, maybe, but it's not readily available in New Zealand. That would have to be imported, so probably not. So that then leaves us with nicotine replacement therapy. And I put here, yes, possibly. But if you're going to do this, you're taking on responsibility for it. There's no current guidance in the New Zealand smoking cessation guidelines that approves NRT officially for use in vaping cessation. So my approach to this would not be, no, you absolutely shouldn't do it. But I think you've got to approach this in a way where you're going to have this discussion. You've documented the use of NRT after a discussion with your client. So you and your client are both agreeing that this is the best course of action, and you've told them that this is not even licensed for vaping cessation. This is only approved for smoking cessation. We think that it can work. It's only giving you nicotine that you would have already been getting from your vape product. It's tried and tested and relatively safe. So you can say all of those things, but you should really document that you've had this discussion and both you and your client agree that that's the best course of action. That would be good practice.
And what would the Ministry of Health think about a fully funded stop smoking service taking this line?
Well, I think that, the times have changed, and if you've got clients turning up to see you, especially if you've helped them stop smoking with a vape product, and now they want to get off their vaping product, I think that's quite legitimate that you help support them stop vaping. I don't think that you're going to have a whole lot of people knocking on your door for vaping cessation treatment. So I think that you take this on a case-by-case basis. You see what support you may be able to offer, and you do so. And I think have a talk when Tony talks to your service, discuss these sort of things. I don't think it's appropriate just to say, no, we only do smoking cessation, go away. I think for people that are requesting support, that we do have some duty of care to provide that. I do think, just on the matter of medication, I know it's very easy to jump to just using medication, but first off, use the skills you have to implement and put a plan in place using some of those behavioural skills you have for smoking cessation. They're completely transferable to some of these areas. And I think that you'd be able to support a lot of people with some behavioural changes before jumping in with nicotine replacement therapy. So final words, my view is you do support those seeking help to quit vaping. Use your knowledge and expertise in smoking cessation to help do that. I think many of the behavioural support approaches that we use for smoking cessation can be translated and used in vaping cessation. Know that the evidence base for vaping cessation is only emerging, and we will get more data over time, but it's going to be slow, especially when we rely often on big randomized controlled trials. In the meantime, utilize these CAM guidelines that I shared with you today in a way to help guide your treatment recommendations. I think that's that.
There's a lot of questions coming via chat, Hayden.
Okay, Grace, where were these studies mainly undertaken? Most are in the US at the moment. That's where they're sitting. We will see more international studies as they come about. Will cytosine ever become available? Hardy, I'd like to think so. And I think, given we've got an absence of varenicline at the moment, it would be nice to actually have cytosine approved. That does involve getting it approved as a smoking cessation medication, which takes some time, or else you get involved in a research trial and you do it that way. But there is others around the world are also trying to think about how we can bring cytosine into that. And yes, Hardy, you're right, because cytosine is not an extract from Corphi, but it's found in Kauwhai. It's actually extracted from another tree, but you're right that the chemical itself is found in Kauwhai. What are the well-respected apps that are available? Amber, there really are no well-respected apps in this space. That would be still in developmental phases. I mention it because young people wanted apps for vaping cessation. But if you do come across some, share them around. Farah, if someone was willing to pay for a private prescription, would GPs be willing to prescribe Champix to stop vaping? That's going to be very dependent on the GP and their knowledge. So that would be a little bit of a conversation, I think, with prescribers to do that. My clients who are vaping as a pathway to quitting, I'm finding are motivated after behavior changes and distractions of first naturally reducing their frequency and then gradually reducing their neck. Great. Thanks, Leanne. That's, you know, and I think if we can share some of these things that work, we'll find some ways and share some of these behavioral techniques. As I said, you know, I wouldn't first jump into using medications. We don't have any strong evidence base for them at the moment, whereas we do have at least some evidence base for behavioral techniques, albeit that they've gone through delivered by text messages. But same, you know, face to face, it would be useful. Can you use nicotine patches while they continue to vape? Geraldine, what are you thinking about there? Are they using patches and vaping to stop smoking? Is that what that is?
Unmute. There are some questions regarding that, whether they can just stick a patch on and, you know, vape when they feel desperate to have a puff, you know. But it's the nicotine that we're concerned about, that we want to help get rid of. So, what do you think?
Well, so if you're using vaping as a cessation aid,
seems to be losing you all the time.
I think that might be.
I can't seem to. I seem to be losing you.
We're losing you too, Geraldine. I don't know whether it's my connection. I suspect it might be yours.
Not all of us.
Yeah.
Yeah, I've been having trouble all the time. So hang on. Okay, can you hear me now?
Yes.
Yeah, I've got that question thrown at me a couple of times. You know, why can't I just want to get rid of not using so much of nicotine. Maybe I can put a patch on and continue to vape when I feel like it, and then slowly I can reduce the nicotine, and then slowly I can quit. You know, that kind of thing.
So that's what I was explaining in one of the latter slides, that would be completely up to you in having a discussion with your client. There's no guidance that I can't say to you, absolutely, you should do this with all your clients. You will need to discuss that and, you know, take that responsibility with your client, in conversation with your client, and work out that treatment plan.
Okay, thank you. Well, I'm really struggling with a lot of my people. Look, if I quit vaping, I just want to continue to vape. So that this is a real struggle for us.
Well, you know, this is not about forcing everyone who vapes to quit vaping. This is not our job. So we're here. So this webinar is about talking about those who want help in quitting vaping, that you provide that. Where people want to carry on vaping, that's a slightly different issue. And there will be a number of people that are quite happy vaping. They're quite happy to accept that it may not be zero risk, but it's less risky than smoking, and they make that decision to do that. I do think within a health system that we do the basic steps of checking on people, do they vape, and advising them to quit. But we're not here to, force people to do stuff, if that makes sense.
Mm-hmm.
So people, there should really be not a push, a health promotion push towards people who are vaping to get them to quit vaping, yeah?
Yeah, I think that's right. That's right, Grant. And we'll probably see that over time. And okay, I think that's especially important in people who have never smoked, right? They've taken up vaping. They've never been smokers. We really don't want these people vaping long term. Maybe vaping no nic and using patches to cover nicotine. Yeah, that's an interesting approach. And Courtney, I see we're agreeing with that approach there as well. So that could be an approach that some people might like to take. Again, we don't know if that works. I suspect it probably does in some people. So if that's what you can do, you do that. That's great. Hardy, is it fair to say that in a nutshell is recommend that we use behavioural support, avoid prescription meds, and use NRT with caution and just through discussion and agreement? Actually, in a nutshell, Hardy, yep, that pretty much sums it up. I think that's the approach we use at the moment, that we focus and use our skills on behavioural support. That includes, reducing the frequency of vaping and helping people put some boundaries around that. I think it's going to be difficult to get prescription medicines prescribed for vaping cessation when there's very little evidence for it and the current restrictions we've got. And then NRT would be used, yes, after discussion, after perhaps people haven't got anywhere with using some of those behavioural techniques, and you might agree that that would be the best next step. Pene, personally been allowing clients to use a vape as NRT if they wish. Yeah, totally fine. Again, when we're talking about, this was about vaping cessation primarily, but I acknowledge that many of you use vaping as a cessation tool or a transition tool. And I also know that many people benefit from using vaping in that particular way. Yeah. Any timeline for varenicline being available? I don't know. Maybe some of you out there know.
I heard, I can't remember where, but it would be mid next year.
Oh, and Farah's posted query August.
Okay,
so we might be. It's really a pity we don't have cytosine to use. Farah, I'm not going to show those other slides again now, but if you find that website for the guidelines, they have all of the particular tools on there in a separate document. So you can have a look at those and see what you might like to use with clients.
This webinar is being recorded at the moment too. So in a day or so, it'll be posted on the homepage of our website, and you will be able to go through it again and then pause the slides that you're interested in seeing. So just give it a couple of days, then check www.nts.org.nz.
So I think the questions have slowed down. I think that's probably all I have to say. But just keep in mind that this is really nuanced, and we're balancing the benefits of using vaping to get off smoking. And for those that manage to do that way, you don't want to rush them to get off vaping either. Some will want to stop sooner than others. Some will stop vaping all by themselves without your help. Some might need some support from you to do that. So be there to provide that support, but you're not going to, berate them for vaping and stopping smoking, because they've done a great job in that transition, and acknowledge that some people will vape sort of for longer periods of time than others.
Hayden, sorry, Hayden, what would you consider a long period of vaping as acceptable? I know lots of vapers who've been smoking for 2 years, 3 years, 4 years.
Well, it's hard, Geraldine, because we don't. So we've had people that have been vaping for maybe 10 years, and we haven't seen any health risk of vaping come from that. I don't know the time where it will be found to have adverse effects. And the other thing that's really difficult to know is that most people who vape were ex-smokers. So trying to tease out any risks associated with vaping are different to disentangle from smoking.
So what you're saying there is that because people may have smoked for 20 years, then stopped smoking and vape for 10 years, you can't say that any diseases they get from those 30 years is either vaping or tobacco.
Yeah, correct. So I think this is what I do. I say, look, it's great that you've stopped smoking. That's perfect. My advice would be aim to stop vaping as soon as you feel safe that you won't relapse to smoking. That's my clinical advice to people. Now, I don't know how long that will be for people. Some people use nicotine replacement therapy for 3 months and they can stop using that and no problem. Some people use nicotine replacement therapy for 5 years, 6 years, 7 years, 8 years. And we continue to supply that.
Mm-hmm. Kia ora, Hayden. Just wanted to thank you for all the information that you've given today. It sort of reinforces me with working with whānau with vaping. Just wanted to share just a story this morning where I had a client that came in who had quit vaping, and her struggle around carrying it around with her all the time, and she ended up using it in the home, using it in bed, using it whenever she wanted to use it. And I actually admitted to her that I wasn't there to actually guide her through that process around how to reduce the vaping, around how many puffs do you have it, try and treat it like smoking, keep it outside so that you're not having it constantly with you all the time. She's quit vaping. She's been 7 months of quit vaping. She did say that she found it really, really hard to quit the vape rather than quit the cigarettes, because she moved from tobacco to vaping. But the other part of her journey is that she was starting to talk about how vaping is really bad. Vaping's really bad. I had to tell her that compared to smoking, where does she see herself with that? And I said, remember the monitor measures the toxins in the cigarettes. And when you're vaping, there's no toxins that's readable on the monitor, the co-monitor. So then she switched her thoughts and go, that's it. That's the reason why I quit smoking, was because of the toxins. So that behavioral change of talk that you're talking about is really just convincing them that vaping is much less harmless than smoking cigarettes. But they've still got to be coached through that. And probably for myself, I was just trying to tell her that I wasn't there for her through her vaping journey, and she never reached out to me for that. So I had to admit that, sorry, I wasn't there. But she managed to do that. And like you said, they'll do it on their own, but they struggle with it. So us as coaches, if they've moved into vaping and we've sort of supported them to move into that vaping space, it's important as coaches that we follow them on that vaping journey and put all those tools that you've just talked about today. Yeah, thank you.
Yeah, kia ora, Sonia. I think you're absolutely right. And as we move into this new health system, this whole false dichotomy, if you like, of I only do smoking cessation, not vaping cessation. That's not what you do. You support people to change their behavior. You support people to become well. that's what you do. It just so happens that you're focused on tobacco use. But if you see that in a more holistic way, then that should guide you in what you should be doing. And when you've got whānau that want support in helping them to stop vaping, yep, be there for them.
There's a few more questions come through on chat, Hayden.
Where were we up to? Taina, should we talk to our contract managers to see if vaping cessation will be recognised? Taina, I just do it. But yeah, sure. Talk to your contract manager about that. I guess you're maybe concerned about where you might record that or show what, you know, resources that you've been putting into it. You wouldn't put them in with smoking cessation, obviously, because it's a slightly different thing. But probably the same way we talk about supporting long-term NRT users is where I sort of put that perhaps in your narrative report. Client for 9 to 10 years, the only thing he was worried about was that he was using it like it was going to run away. Yeah, I think, and that's back to Sonia's client as well, that sometimes with vaping, people are using it much more frequently than smoking because the social restrictions aren't there to limit its use, right? It's perhaps seen as slightly socially more acceptable. And so when there are no rules around where you do it, and you're vaping in bed, and you're vaping inside, and you're vaping everywhere, it potentially becomes more difficult to give up for some people. And yeah, people tend to use it more. I guess just with that particular client, you might, you know, want to check that have they changed their nicotine dose? Is that why they're using it more? Can they set some boundaries or rules around where they vape? Can they leave their vape behind in the morning or only use it at certain time points? So those are sort of things that can reduce or help reduce the frequency of vaping. For school inquiries, a recommendation of behavioural support with showing benefits for abstaining and wellness. Yeah, I think that's really good. I mean, you saw the data from young people. They didn't really want to go and use medication. So that's where I'd stick with some of those behavioural strategies here. I think that was it.
But can I, with services and individuals who are stop smoking practitioners, and they're getting requests from schools to come and support their students who are vaping to quit, which is happening, and they go into the schools and the kids, you know, say, I don't want to quit. I just got told I had to come. How would you deal with that?
Well, you know, I'd work with the schools to look at what they're currently doing. You know, do they have a no vaping policy? They probably do. Is it enforced, and how is it enforced? I don't think that suspending students from school is a good outcome of being caught vaping. So it may be that there is some information that's put forward to schools. You do have health promotion within your tobacco contract, so that might be something that you work with. It might be, you know, that the research is saying students want to know why shouldn't they do this, and maybe you can reflect on some of your clients that have, you know, okay, they've quit smoking and they've become vaping, and then they've still felt that they're a slave to vaping and they don't want to do that. You know, loss of control over a behavior is an incredibly frustrating thing, and maybe that's, you know, something that you can sort of get across to young people, that, you know, whilst this is a tool for smokers, if you don't smoke, you shouldn't be vaping.
So that would be your approach to schools.
Yeah, I think look at what they've got in that, you know, often it's very much like, oh my goodness, they've been caught vaping, we need to refer them on, without really knowing what's going on. It may be just that a little bit of factual information is what those students want. Engage with them, explore with them. It's not about telling them off. You know, they're into experimenting and all sorts of things. And I think what's really coming out is honest conversations is really important. Please don't go in there and tell them that vaping causes heart attacks when we don't have that evidence. But you do know that some people struggle to stop vaping.
I think that's the problem in schools. A lot of school staff believe that vaping is more dangerous than smoking.
Yeah, and that doesn't help, does it? When you've got those messages going out and the Ministry of Health saying, oh, vaping, can be a tool to help you stop smoking. It's really difficult. I think communicating the relative risk has been a little bit of a tricky area. And as we've discussed before on webinars that I'm sure some whānau have heard, vaping is less harmful than smoking means vaping is safe. And that's not the case. If you smoke, yes, vaping is a less harmful, it's a harm reduction approach. It's a way to transition out of smoking. But if you've never smoked, then taking up vaping is likely to be associated with harm.
Excellent.
And thanks for that. Aparina, Megan, yeah, some less punitive approaches to students caught vaping. I think that's a much better way of getting them to think about their behaviours and change than kicking them out of school for a few days.
Okay. I think if there's no more questions.
I think I have one more. You talked about incentives, good examples of.
Yes, there's some early research around how incentives might be utilised for vaping cessation. Again, we don't have strong evidence for that, so you'd be translating perhaps the evidence that you use for smoking cessation across to vaping cessation.
Okay, that looks like us. Thank you so much, Hayden. That was really informative. I'm sure we've all learned a lot, and it's we have the Tobacco Control Conference occurring in Rotorua in the end of May, and I'm sure this sort of debate around all of these issues will be going on at that conference. So it's open for registrations if you would like to come. But thank you again, Hayden. Is there anything you'd like to finish with?
No, I think that's as always, happy for people to contact me as needed.
Okay, well, kia ora koutou, and thank you for taking part in this, and it will be up on our website in the next day or so, so look for that recording. Yes.
Kia ora.